Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Well, from anxieties about working in care homes to money concerns for staff from abroad who work in the NHS. Tens of thousands have to pay to use the service they work in. The immigration health surcharge was introduced in 2015, adding £200 a year to the cost of visas for immigrants from outside the EU. The aim was to stop what became known as health tourism. In 2018, it doubled to £400 a year, and this October it rises again to £624. For children, it'll be £470 per year. It means for a 3-year visa, a family of 4 will have to pay more than £6,500 in advance. And from the end of the Brexit transition period next January, migrants from the EU will have to pay it too. NHS workers have been telling us today it doesn't seem fair, particularly during this national crisis.
Eva's working day starts early and ends late.
You are exhausted emotionally, you are exhausted mentally and physically.
In her service of our national health.
It's quite petrifying.
She's tended at the bedsides of dozens of Covid-19 patients.
When you nurse patients in ventilators, then you're always crossing your fingers that, the day will end and their lives will be spared.
And yet Eva, from Kenya, must pay extra for the privilege of using the NHS herself. So when she next renews her family's visa, they'll face a bill of £11,000.
It makes my head spin. I can't afford it. I always have to go to loans. I have to always top up loans, and sometimes I have to ask for help from my friends.
The NHS surcharge was designed to deter so-called health tourism. In fact, it's paid by people, often on low incomes, who work here, including those now risking their lives on our behalf. Kartik Butt and his wife are both doctors. For their family, they've just paid a £3,600 health surcharge.
It's very demoralizing, especially when you are coming to work, you are working full-time, giving your time and your health onto NHS to keep it going, and you're being asked to pay.
This evening, Eva joined the nationwide applause for frontline staff. The climate for migrant workers has changed, no longer so hostile. The government has extended some health visas and waived the surcharge for a year, and hints at a wider rethink.
This charge is about making sure that everybody who's in this country is paying their fair share. Well, that doesn't in any way undermine the huge debt and thanks that we all have and should have, quite rightly, to everybody working in the NHS.
It's hard to find words to express my debt.
But to a Prime Minister who says he owes his life to the NHS, Nurse Eva has a message in return.
The greatest thing he can do at this point in time is to immediately scrap this surcharge fee.
It is, she says, a debt of honour, and it needs to be repaid. John Ray, News at 10.